I have spent my 18 years in guided surgery and digital implantology. Now, what I can see, the industry is getting segmented in multiple groups. There are some practices who trust the guided surgery blindly. That means they know all the resources, all the workflows are involved with the guided surgery system. Another group is there who simply trust on the experts who's doing the guided surgery planning on their behalf, and they're just using this application on the basis of trust. Third group is there who doesn't appreciate this new advancement just because they don't know, or maybe they don't want the guided surgery to take the place of their freehand surgery. And why I'm creating this content, because I'm seeing this group is widening day by day, every single day, and I don't want you to be on the wrong side, because you just need to follow the right thing and right information. So I experienced something in my entire journey. There are some situations are there I learned and I experienced about this industry. So I'm going to share 5 moments and lessons I learned from my experience. So the first moment, when I was in my early career, I was involved in the guided surgery program, and I had little bit of idea about this anatomical structure and how this guided surgery workflow involved. I could see some practices which already indulged with this guided surgery workflows and all. The consistencies were missing. Every day they're facing new challenges, or you say they are delivering productivity in one patient, or another patients they are struggling with the damaging vital structure, they are damaging nerve, adjacent tooth probably, or damaging the anatomical structure. They are facing the lawsuits, their patients is suffering, right? And I realize experience alone is not enough when anatomical all the stories involves in 3D dimensions, right, that we can't see in traditional implant surgery. So what we learned, your experience is not enough to validate the entire or to give the smooth patient journey. Sometimes we don't see in the real bone, or after at the time of surgery, what we can see in the 3D environment, or assessing the anatomy in digital implantology environment. Moment 2, when I started this image 3D conversion in 2013, my simple belief was that to give the opportunity to all the practices with the digital implantology experience. My goal was not to do thousands of cases. We worked closely with the clinicians. We tried to understand the errors, failures, situation they struggle in the freehand surgery. Then we defined one by one all workflows. Initially it was very difficult journey. All the situations was uncertain, lot of failures. We used to do 12 cases in a month, 12 to 15 cases in a month, and gradually, slowly we got the opportunity to involve with thousands of cases. Now we haven't only experienced the failures, we validated the systems, we validated the workflow, so that we can accept the new all the challenges, and we are right now delivering the productive outcome through this most modern implantology workflow. So what we learned, building credibility doesn't happen from one single case or using one software. This goes slow after using one by one patient, experiencing the system, understanding the workflows, until it follows a reproducible system or reproducible standards. Moment 3 that I'm experiencing today also, there are some practices who started their implant practice since last 2-3 years probably, and they are incorporating their modern technology guided implantology, and they are delivering implant and prosthesis with exactly as expected way. But same their other side, their experienced surgeon, 25-30 years experienced surgeons are there, or practices are there. They sometimes struggle to deliver the exact connections of the prosthesis and implant mechanism. maybe with the anatomy or anything I'm saying, but it doesn't mean they're not well skilled or 3 years experience are well skilled. 3 years experience or the new practice who's aligned with the digital implantology, they are just taking the advantages of the modern practice with the freehand skill. So what we learned, technology is not replacing anyone. It is helping one common dentist with good implant practice, with freehand knowledge, collaborating with the modern concept can outperform anyone, be it experience or non-experience. So technology should not threaten you, it should excite you. Moment 4, when I started my journey of the guided surgery education, I realized one thing, that practices struggle to raise the doubt or to ask the questions in associated with the digital implantology opportunities. They are struggling to validate AI, how software is involved, what are the workflows are there, or what opportunities they can claim. Industries are trying to sell just a tool without giving them the strength of making judgment, and that is why I shifted my profession, just selling the services to teaching the profession in a right way. So what we learn, tools and softwares are everywhere, judgment is rare. So rather focusing on only the softwares and all these digital things, we need to develop our skill how to get the exact opportunity of using the digital environment or new technology or modern concept. Moment 5, we can see industry splitting in different parts. Some practices are enjoying the entire journey, validating patient, giving the full satisfaction to their patients, like educating patients, building the confidence, generating revenue, and just following the applications with the modernizations, with their practice standards. Other practices are involved is carrying doubts, facing everyday challenges, delivering failures, or everyday new surprises in their journey. Third one is not following anything and randomly doing the freehand practices. They are of course happy, but not taking one opportunity that is behind and that is involved strongly in their industry. So where do you want to stand in this modernization? So what we learned, market won't wait for you to feel ready. Some practices follow with the standard workflow and patient is appreciating their standard of practices. Competitors are growing, modernization is booming fast, and we just need to evaluate ourselves in what modernizations and stage we need to stand with. So let me connect you to this lesson where you might be right now. If you are struggling with the fear of guided surgery will limit your freedom of surgery, then lesson 1 is for you. It's not about limitations, it's about taking the opportunity what you do not see in the real time. If you are overwhelmed by what digital systems to adopt and what applications is right for you, then lesson 2 is for you. Start with one validated systems and right workflow systematically. Consistency beats perfection. If you're worried that you don't have that much of expertise to compete with the specialist, then lesson 3 is for you. If you're confused by all the AI and software flooded in the market, then lesson 4 is for you. Your job is not to trust the application. You just need to validate the applications and the workflow clinically. And if you're waiting for the right time to invest on the digital workflow, then lesson 5 is for you. The right time was 3 years ago. The best time is now. Here is what you can expect from me. I will create content associated with the digital implant workflow, guided surgery platform, implant planning, and how you validate prosthetic driven guided implantology so that you can critically think about all the opportunities that you have there in digital environment of guided implant practice, so that all the single opportunity you can claim, and you can enjoy one of the trusted platform of dental implantology. I bring 18 years of experience, thousands of cases planned, and the perspective of someone who has built the system from the ground and not just the use them. If you're a general dentist or if you're looking for implant practice to start with this digital concept, then this content is for you. Follow me for the weekly breakdown what is actually happening in digital implantology. No sales pitch, no fluff, and the real content on digital psychology of implantology. Let's build the future of digital implantology together. I'm Sudeep Paul, and I'll see you in the next video.